morning. It's a complete shift in the presentations and the topics from the morning, and I hope to get my first slide. So I'm privileged here to be in Tunisia with the Tunisian Orthopedic Congress, and my talk is going to be about research education. So it's not related to the pediatric orthopedic sessions in the morning, although I'm a pediatric orthopedic surgeon, but then my topic is a little bit different. So, yeah. It's about research education. Is it an option or necessity? Coming from Saudi Arabia and being an editor-in-chief of Journal of Musculoskeletal Surgery and Research, I have written an editorial about this, and they asked me to present it here in this meeting. So we'll start with just like a case. So an author contacted one of the major journals that we all aim to publish in, and asked the editor-in-chief about an obvious deficiency of Arab countries' scientific contribution to his journal. So simple, straightforward question, why we don't see enough Arab publications in your journal? And the answer was quite long. So to summarize it, the answer was, to your query is very simple and straightforward and relates to the research methodology and the soundness and originality of research undertaken. So the answer is quite straightforward, but then we all, as Arabs, we all believe in conspiracy theories, and then we think that they are against us and they're not going to publish our work. The justification is that all peer reviewers are blind, and therefore the country or the origin is not necessarily clear to them. So what they see is the article or the manuscript. They don't see where the article comes from, unless if you have written in the article that it was done in certain country or something to show them. Otherwise, they won't know. And should a high-quality study from Arab country be submitted, they will, of course, be considered. So that's a straightforward answer. Why don't we have enough publications there? Because we don't have enough good quality papers coming there. So the objective of my presentation is to determine the importance of research, determine the importance of research education, and then describe how can we improve the research education so we can get more published papers in Q1 journals. They're the most prestigious journals that we all hope to have our papers in. So what is research for us? It's a systematic collection of information to learn more about clinical phenomena. So we're saying clinical here because research covers everything, and as clinicians, we are more interested in the clinical part. So it could be about medications, about devices, about diagnostic tools, or treatment regimens and protocols, which are intended for human use because we are clinicians. Our goal is, as clinicians, usually is to prevent diseases. And if we have the disease already, then we treat the health problem, reduce the suffering, and improve the patient quality of life. And I think the presentation just presented by our colleague from neurosurgery is an excellent example of how do we improve the quality of life. So why doing research is important? Research in health sciences plays an important role in the country's economic growth. So now when we compare countries, we compare how much of good quality research coming out of that country. Sustainable development and improvement in standard of living and quality of life. The government across the developed world have increased research spending to aid their economies. So they know that if they spend more on research, they will get as a return back. This idea is not apparently clear to many of the Arab countries, unfortunately. This is why we don't spend more money on research, because we don't know that we are going to get it back and get it back more. This is what they first world countries or the developed countries have understood before us. So why doing research is important? To find answers to clinical problems. As clinicians, we look for answers. To build or advance our knowledge, and to stay up to date with the valid information, evidence-based medicine. To improve patient care. This is why we are clinicians. This is why we have gone through all this to become doctors, is to improve the patient care. Research is the engine that drives knowledge forward and empowers clinicians to learn about themselves, design appropriate studies to support clinical practice, build a data bank, adopt the best diagnostic and treatment modalities, so promote feedback regarding the practice and effectiveness. So if research was not done on patients, then we will not improve on their patient care. Promote change in attitude. So if our neurosurgeon wants to change the management around, so he has to do the research to prove what he's doing is the valid or the better solution for his patients. So the level of patient expectation according to real benefits of the treatment offered. So many times we do surgeries and we think the patient has improved, but then when we ask the patient tells you, no, doctor, I'm not better. I may look better on X-ray, but functionally, I'm not. So this is what research is going to tell us about our patients. Clinicians are always encouraged to write down and publish their results. All your institution asks you to publish some more papers because that increases the rank they're having, despite knowing that publication is a consequence of an overall scientific investigative attitude. So it's not just writing a paper. So what do we need? We need better conditions for training, how to do, the know-how. So how can we get that? We can get it if we train our trainees and our students, even early in their student life during medical school, on how to write research. Promoting joint scientific activities to exchange experience. So it should be joint and multidisciplinary. So if we want to show that the dorsal-rhizotomy is good, then we have to work with our rehabilitation services, with the orthopedic neurosurgeon and neurologist to show that these patients have a better life after the surgery. Identify the use of strength of research centers. This is important, so we have to build up our research centers, and this is how do they have, in the developed world, better research coming out because they have good research centers and they have joint activities. Stimulate multi-center projects and even across countries. Maximize the human resources and improve fund allocation for research. So some of these are in our hands. We can work together. We can teach our trainees. We can help them, and we can monitor them and mentor them. But then some of these are not in our hands, but we can still try to get it through. So in that sense, research is essential to challenge current paradigms, provoke thoughts, and open minds to new ideas and skills. Example, this is a little example that Agnes Semmelweis, who was in the 1800s, he was early pioneer of antiseptic procedures. How did he come with that? He found higher incidence of childbed fever, at that time it was called, in maternity wards staffed with doctors, compared to those with midwives. So the wards that have doctors doing the deliveries have more infections than the wards that have midwives. So it did not make sense. So there should be a problem causing that. So he was the one who spent time to try to discover that. So he discovered that incidence was drastically reduced using hand disinfection after doing autopsies. So it was like the doctors doing autopsies and then going to the delivery ward and doing the deliveries, so they get the infections from the autopsies to the mothers with the deliveries. Whereas midwives, they don't do the autopsies, so they don't have these infections. So it is common sense, but unfortunately, common sense is not common. So you need to find out that. So he proposed the practice of hand washing with chlorinated lime solution in the 1847, and that changed the mortality rate dramatically. So it's an observation that was translation of distinct clinical information into correct neuromedical fields. So knowing that, try to know the numbers behind it, and then he came out with define the incidence of death due to the childbed fever, find the association between the cases and doctors performing the autopsies. So he was smart enough to find that there is a relationship between this event occurring. Retranslate the information, encoded the numbers into clinical language. So after he understood the problem, now this is more here than there, and this is the cause of it. So how do we reduce this, change the practice to washing hands with chlorinated lime solutions? Hand washing is one of the most important tools in public health since then. So it's an observation, it's the research process. It's an observation, then you do your research work, then you come out with solutions, and then implement them and see the difference and see the outcome. So the nature of education requires research as its fundamental base. So now if we're comparing research to education, but then these two, are they one or the other, or they complement each other? The clinician can only improve their skills and knowledge through inquiry. Otherwise, knowledge stagnates and becomes obsolete. So if we do not attend conferences and then listen to others, what do they say?